Some people are told your knee pain is just because the cartilage has worn away. But if you have been living with this pain, you know it is never that simple. Because sometimes the X-ray looks terrible, yet the pain is not so bad. And sometimes the X-ray looks only mildly changed, but the pain is enough to disturb walking, sleep, and even daily life. Why does that happen? Pain is not only about what has worn out, pain is also about what the joint has become. Osteoarthritis is not just a wear and tear problem.
Inside the joint cavity, inflammation triggers a complex cellular response. Inflammatory cytokines float within the synovial fluid, accelerating tissue damage.
It is a biological change in the whole knee. Hi, I am Dr. A-Kavach and I want to explain something very important. Cartilage itself does not feel pain. Healthy cartilage has no blood vessels, has no nerves, so the pain is usually coming from the other tissues in and around the joint. That includes the synovium, the ligaments, the joint capsule, and the bone beneath the cartilage.
We first highlight the synovium, glowing here in amber. Next, the outer fibrous capsule and ligaments. Deep red indicates lesions in the subchondral bone.
So, when a knee becomes painful, it is often not just because something has worn out. It is because the whole environment inside the joint has changed. As osteoarthritis gets worse, the balance inside the joint begins to wear down. Tiny cracks can form, new blood vessels can grow into places they should not be, and once those vessels grow, pain fibers can follow them. That means the joint can actually become more able to generate pain. That is why two people with the same diagnosis can feel so differently. One person may still manage day to day, another may struggle to climb stairs, walk to the bathroom, or sleep through the night.
For some, every movement is a joy, living life to the absolute fullest. But for others, even rest can be a painful struggle.
The X-ray does not always tell you the full story.
These X-rays reveal clear joint space narrowing, and we can see some definite bone spur formation. But this structural view doesn't tell us the whole story. Images alone don't reveal pain intensity.
And this is why many patients feel disappointed when they are told only, your cartilage is gone, because that does not explain the pain. And it does not explain why some treatments help only for a short time. When we understand knee pain properly, we begin to ask better questions. Not just how much cartilage is left, but why is this joint painful and what's driving it? That's the philosophy behind the PRASAD Protocol. Before asking a joint to heal, we first address what's still damaging it, which is why we begin with A-Kavach. Our biological shield before PRASAD itself. You can't extinguish a fire by treating the smoke. If you're in Chennai and knee pain is affecting your walking, your stairs, your sleep, book a consultation. Let's look beyond the X-ray and build the right plan for your joint. In my next video, I'll address one of the biggest areas of confusion in regenerative medicine. The claims made about allogenic stem cell products and where the science does and does not support the marketing.